It's hard to believe this is our final session for the 2012 Digital Health Summit. It's truly flown by, but I think you'll agree we've covered an enormous amount of ground in 2 days. From cool gadgets to complex economic models and policy to health-related social gaming and the next wave in personal environments, it's a lot to take in, but certainly worthwhile as the world is changing fast, and we need to keep up with it. And perhaps lead the way where we can go to make it a better place through digital health technologies. It seems fitting that our final session is about quality of life. Which technologies are improving people's lives right now and revolutionizing the way we live, like mobile health and disease management? I'm going to introduce all of our speakers now in the order that they will be presenting. Michelle Ahlman, to my left here, is president, the only woman, obviously named Michelle, is president of ClearSounds Communications, a Chicago-based small women's business enterprise that designs, manufactures, and distributes sound-enhanced and high dB gain products for the boomer, senior, and caregiver market. Michelle literally grew up in the assistive technology business, working with her parents who founded the mother company, High Tech. Is that how it's pronounced, High Tech? That's what I thought. 30 years ago. She now serves on the vendor advisory board for National Audiology and Hearing Health Publications and is a published author of industry-related articles on assistive technology. In addition, she's the current secretary of the Age Tech Alliance Board, which I participate on as well, which promotes the awareness of and brings high technology to senior products. An avid runner and triathlete, Michelle is a firm believer in technology as a tool to improve quality of life. I'm next going to introduce Terrence Gregg. He is CEO of Dexcom, the leader in continuous glucose monitoring for diabetes. Previously, Gregg served as president and COO of MiniMed and was instrumental in Medtronic's $3.4 billion acquisition. Lucky guy. Gregg has dedicated his life to helping people manage their diabetes. He and his wife, Louise, are among the leading diabetes philanthropists, having donated more than $2 million to diabetes causes. It was Gregg's devotion to diabetes research that brought him out of retirement in 2005 to join the Dexcom brand, due to what he considers a moral obligation to see completion the development of an accurate, easy to use continuous glucose monitor that saves lives from hypoglycemia unawareness. Gregg recently was honored as a finalist for the Ernst & Young Entrepreneur of the Year Award in 2011 and was named MassDevice.com as one of the 28 chief executives who exemplify cutting-edge leadership and innovation in the medical device industry. On to the last one, and last but not least for sure. Susumu Sone is responsible for developing U.S. marketing, sales, and business strategies for NFC Felica, building alliances and conducting marketing sales activities to explore new market businesses. It's been a long day. He has been involved in overseas businesses for more than 10 years with Sony and previous companies, including 7 years in New York City. Prior to taking responsibility for the US market, he was responsible for the EU and Russian markets for 2 years. Then prior to joining Sony, he worked with Japanese mobile network operator, where he developed and launched new businesses related to mobile application services and built solid partnerships with overseas mobile operators, content application providers, entertainment companies, and technology companies. I'm going to let each of them present their quote-unquote case studies about their impact to consumers' lives with their technologies. Thank you.
Good job. Hello. A 29-year-old woman stands in front of us, fiddling with her iPhone. She's agitated, frustrated, low on patience. Come on, she shouts, as we're setting up her Bluetooth neck loop for her to try at a consumer trade show. We understand her frustration. This isn't the first time that we've worked with an individual who seemed angry and might be considered difficult to most. You see, Bae is a 29-year-old who has lost her hearing, newly engaged, working hard to forward her career. She has a profound hearing loss that came on very suddenly. She lost her hearing in a period of 9 months when she was only 20 years old. She spent the next 4 years frustrated as she had 3 different cochlear implant surgeries, the first one a complete failure. She's avoided the many things that she's loved, visiting with friends, talking on the phone. Even her mom has stopped calling her out of frustration in dealing with her hearing loss. Her new implants are working, but she's still missing an awful lot. She was managing but is in pain, both emotionally and physically. The very sounds she had once loved had become painful, and it hurt for her to feel alone. As we continue to fiddle with the neck loop, connecting it, adjusting the volume, she's messing with her iPhone and finally picks a song by Pink that she knows but has never really heard. As she does this, she keeps saying, "This isn't going to work, this isn't going to," and she stops. Her head jerks up and she gasps. Her fiancé, standing next to her, says to her with concern, "Are you okay?" As tears begin to form in her eyes and stream down her face, she says quietly, "I can hear it. I can hear it. Oh my God, I can understand the words." We stood there together in that moment, knowing the impact this would have. In that moment, her life had changed. And in that moment, we were reminded that the technology that we create has changed yet another life. We know hearing loss impacts lives, and that technology has a massive positive impact on the lives of those with hearing loss. But how does hearing loss impact healthcare? And what can technology do to change that? Hearing loss, and we know the impact of hearing loss is vast, yet it's one of those things we tend to ignore. Let's look at the statistics. 34% of hearing loss is noise-induced. 40% of American soldiers coming back will have profound hearing loss. Johns Hopkins just released a study that says 1 in 5 Americans over the age of 12 have profound hearing loss enough to affect communication. However, we seem to ignore it or be naive that the reality of hearing loss can render much of the technology we're talking about here today ineffective. In fact, much of the technology we're talking about, from telemedicine, home monitoring, mobile health, requires an interaction between patient, caregiver, and medical care provider. Think about it. In order for us to use the technology, for it to work effectively and safely, the patient must be able to hear clearly. Why then is hearing loss for the most part ignored? Is it because our perceptions of hearing loss are that it's really not that big a deal? It's harmless. At worst, it's annoying. People don't die from hearing loss, or do they? What are the physical, emotional, and social consequences of untreated hearing loss? Often when I introduce myself and say that our company's been designing and manufacturing technology to help people hear clearly, their well-intentioned response are, "Huh? What? Is that cute? Is it funny?" Yeah, that's the intention. But you know, it's a glaring example of how flip we are about hearing loss. Now that we don't have to be all heavy about it, but it definitely requires a deeper discussion. Johns Hopkins and the National Institute on Aging just recently released a study indicating that untreated hearing loss results in a 5 times greater risk of the development of Alzheimer's. The study, released in February of 2011, indicates that seniors with hearing loss are significantly more likely to develop dementia than those who retain their hearing. The findings, the researchers say, could lead to new ways to combat dementia. They speculate that hearing loss could lead to dementia by making individuals more socially isolated, a known risk factor for dementia and other cognitive disorders. Whatever the cause, the scientists report, their findings may offer a starting point for interventions. Introducing technology to physicians and primary care providers that allow them to quickly and effectively test for hearing, in addition to offering patients affordable technology that could delay or prevent dementia by improving patients' hearing. We did a case study with our nonprofit partner, Americans for Better Hearing Foundation. We followed the treatment of a Chicago area nursing home resident, a patient we'll call Miss Betty. Miss Betty's 104 years old. She's a Medicaid low-income patient who is withdrawn, non-communicative, non-responsive, and recently diagnosed with dementia. Miss Betty was visited by the Americans for Better Hearing Foundation as part of their site audiology program for low-income nursing home residents. She was given a battery of audiology tests and found to have significant hearing loss. The nursing home staff had indicated that Miss Betty previously had hearing aids, but they were unable to be used, they got lost, and they hadn't replaced them. The nursing home assumption that was made was that the traditional hearing aids she had worn would be ineffective. The doctor of audiology that was treating Miss Betty prescribed our new Maestro hearing aid, a body-worn device that offers digital binaural hearing. The key difference with the Maestro and the traditional hearing aids is size. It's easy to adjust and something the doctors could adjust for Miss Betty there. What were the results? Within minutes, she was hearing. She recognized the voices that were being directed to her. Her eyes lit up. She immediately became responsive to conversation. Within hours, she was active and communicating with the staff. After a follow-up appointment, the doctor advised that Miss Betty's original diagnosis for dementia was based on her inability to communicate and interact, which was a direct result of her hearing loss. Miss Betty's quality of care and quality of life had dramatically changed for the better with that piece of technology. Delivery of healthcare is verbal. Another good example. Olga's a 95-year-old woman, sharp as a tack, a feisty, independent widow, living in an independent living center. She visited her cardiologist to review her treatment plan, as she had not been feeling well. The doctor did some diagnostic tests and determined she needed a new drug protocol. During her visit, the cardiologist explained that the protocol she was given was to increase the level of the medication but reduce her dosage. He asked her if she understood. She nodded yes. The next morning, she woke up and took her meds. Later in the day, she felt ill. By the following morning, she was being rushed to the hospital, non-responsive and having difficulty breathing. She was terrified. What went wrong? The doctor had changed her prescription to a more powerful medication that required less dosage. Olga had told the doctor she understood what he said. She understood what she was supposed to do. When she got home, she took the same dose. Why? She couldn't hear the doctor. She was embarrassed. She has severe hearing loss. Although she was fit with hearing aids years ago, they just weren't functioning properly, and her cardiologist didn't know this. The misunderstanding resulted in her near death. Hearing loss is not a harmless condition. What could have been done differently? What could have been done to prevent this or similar tragedies? By maybe incorporating some simple, cost-effective tests into her treatment plan, by her cardiologist simply being aware and informed and educated about hearing loss. Take a good look at some of the healthcare solutions that we're talking about. How many of these technologies involve a verbal interaction between healthcare provider, caregiver, and patient? What if the patient can't hear clearly? Is care compromised? It seems so fundamental, yet so completely ignored sometimes. What if there were educational programs available to healthcare providers that trained them on simple methods for testing hearing loss, or how to incorporate those into their practice? Not only dramatically improving the quality of care they provide, but protecting them from risk and providing additional revenue opportunities. What if there was a way to turn the waiting room, whether it be a primary care physician's office, a cardiologist's office, into a tool to educate patients about the importance of hearing, to educate staff about how to communicate with people with hearing loss, and to provide much-needed additional revenue sources to medical care providers? What if there were technologies that are cooperative, enhancing the effectiveness of the various mobile telecom, home monitoring solutions being presented here today? The good news is there is. Technologies can be utilized by both medical care providers and patients that provide both a mechanism to test their hearing, to manage it, not just with amplification, but with customized, sound-enhanced technology. Technologies that empower the patient and the care provider, improving care and quality of life. So what are the opportunities? From the development of a new over-the-counter category for testing and treating hearing loss in retail, to the development of technology that allows the user to completely customize the sounds they hear to fit their specific needs. ClearSounds is proud to be a leading advocate and leading technology provider in this space. Through our Hearing News Network Physicians Business Development Corporation, we're introducing digital media platforms that convert the doctor's waiting room into an educational setting, both for patients and staff, as well as provide opportunities to the medical community to generate new revenue sources. We encourage you to take a deeper, more serious look at hearing loss, how it impacts technology that you use, create, or care for your patients, or use yourself, as I suggest that hearing is really the nucleus of quality care. So we're happy to answer any questions if you come visit us or contact us, clearsounds.com, or you can see me after we're done. Thank you.
Well, as Jill said, Dexcom is a continuous glucose manufacturer. we manufacture a device that is a body-worn sensor that continuously reads glucose for patients today with type 1 and type 2 diabetes. But I want to frame the opportunity and the challenge of the disease. First of all, in the United States, 26 million people are afflicted with diabetes. On a global basis, it's well over 360 million. And unfortunately, in the next 15 to 18 years, that number will increase beyond 500 million. But if we just focus on the United States, every single day in the United States, 1 in 3 children born today will develop diabetes at some point in their lifetime. Think about that, because that's 33% of our future population. 55 people will go blind today because of diabetes. 230 people will have a body part amputated, usually a lower extremity, a foot and an ankle, or a whole leg, every single day because of diabetes. It is an insidious, devastating disease to people who are afflicted with it. So what do we need to do? We need to come together with innovative technologies that allow patients to live a more fulfilled life, to avoid the serious complications of developing diabetes in the type 2 market. In the type 1, they have no choice. Diabetes is an autoimmune disease in which the typical age of onset is still preteen. So as a result, they have a lifetime of challenges. They don't get a vacation. Diabetes is with them every single day, 24/7. And it is a transactional disease in which you can't take a shot, a pill for a day, for a week, for a month. You have to deal with it each and every day. So what have we done wrong to date with all the technology that is currently available to us? We've had finger stick measurements now in which you take a small sample of blood, you put it on a strip, you read it in a meter. And certainly there are technologies here that are talking about that. The problem with a blood glucose meter and a single finger stick measurement that it's a static snapshot. It's only that point in time. And so the dilemma for the patient is as glycemic variability goes up and down, you don't know really where you're headed. There's no directional displays, there's no alarms. You simply know that at that point in time, you measured, let's say 150 milligrams per deciliter. As an example, if you don't have diabetes, throughout the 24-hour period every day, you're going to range between 80 and 140 milligrams. If you have diabetes, you routinely range between 40 and 400. So a patient with a single finger stick has no idea where they're going. And if you don't know where you've been, you cannot know where you're going. As a result, we've introduced technology that allows that constant flow of information. We've combined that with alarms, trend screens, everything that we can do to protect the patient to avoid the symptoms and consequences of diabetes. And that is really the main message. We are a medical device, and as a result of that, we are highly regulated by the Food and Drug Administration. So since 2006, when we first received FDA approval for a PMA, we've introduced 3 successive generations of technology. Today, we have a fixed handset in which we wirelessly transmit to. But if you've been to the booth out here associated with the Garmin enterprise, you will see that next generations actually port to smartphones. And we begin to use cloud computing for data analysis and reports not only for the physician, but for the patient themselves. So this world is revolutionizing. And if you were lucky enough to be here on Tuesday and see Dr. Eric Topol's presentation, you can see what some of that technology, inclusive of ours, can do for patients. We do allow patients to live a more fulfilling life. Thank you.
Hello. Hello, everyone. My name is Sone. I was born to work with Sony. Anyway, let's get started. So, top awareness. NFC dynamic time brings easy way to know your body. That's what I will talk about today. Let's take a look at how wellness healthcare devices has been changing. If you see from left to right, from analog measurement to digital display, then multifunction with memory. So it's absolutely getting smarter and more intelligent. However, sometimes human behavior doesn't change. This is a funny example from the annual metabolic checkup. As you see, the guy is trying to cheat the measurement. Unfortunately, regardless of his effort, he was identified as metabolic. So to manage wellness is not just the matter of the one-shot measurement. More important thing is to track the record, to know the trend. But how to do that? Well, I can share a couple of the examples commonly used. To use the reliable memory, that's one thing. To take note, another thing. To input data using the Excel sheet, no way, just 3 days, I can guarantee. There exist other smarter ways using technologies. However, each one has some issues. For example, cable is required, power consumption is high, pairing is required, like that. So how about NFC? Like near field communications, a contactless technology. In case of NFC, we can utilize the benefit of low power, no pairing is required, and open standard. So why not? Let's take a look at what happens with NFC. Just tap the reader and boom. It's just that easy. It is simple, easy, and reliable. Today, I'll talk about how NFC changes the way from 3 key areas: the device, the reader, the applications. First one, the device. In order to make any healthcare awareness devices as NFC device, we have developed NFC dynamic tag. This is a module with antenna. Just embed the tag in the device, and then device gets NFC ready. So it's pretty simple. Once tag is embedded in the device, how to use that? Well, you just tap the NFC handset or NFC reader, and then dynamic data stored on the device, such as a pedometer or weight scale, will be transferred up to the cloud. So this is the easy way to track the record and to know the trend. So again, tap wellness, NFC dynamic tag brings easy way to know your body. NFC dynamic tag comes with 3 different options: 2 different size of module with antenna, and chip only without antenna. This gets very low power consumption, both for standby mode and also operational mode. Probably this is one of the most power efficient solution out there. Numbers of products from weight scale to body temperature monitor, heart rate monitor are commercially available through different vendors. We cover from wellness to healthcare. So second thing, the reader. Any NFC smartphone can be the reader to work with those devices. Currently in Japan, more than 68 million handsets support embedded mobile fabric contactless chip. And also more than 12 million of USB reader for PCs and PC embedded reader and TV remote controller support embedded NFC reader and fabric reader. So this could be the reader. In addition, according to the report, by year 2015, close to 1 billion of smartphones will support NFC. You can imagine how significant the figure is and how great the potential is. So third one, the applications. This is very important. If the device can be supported by single dedicated applications, it is very hard for the market to grow. Instead, each device should be supported by multiple applications more freely, more openly. This gives you more options for the users to choose. Previously, the issue was each apps provider had to negotiate with each device manufacturer in order to obtain the data format. As you can imagine, this is very much complicated and time-consuming. So we have addressed this issue by developing new business framework where app provider will obtain library easily to support multiple devices. Sony will be the interface with apps provider to provide the library. With this, each app provider just focus on development of their applications. Good thing for this is it is free and open to anybody. We launched this as NFC Healthcare Library back in last October. We do support both NFC Android phone and also mobile Falca Android phone. Start supporting from Android, then expand to other OS in the future. We do have numbers of partners already for this approach. We are adding more and more. By combining any device, any reader, any applications effectively, the market grows significantly. Now I will show you a short movie video. So maybe you can directly play the video file. So data will be uploaded up to the cloud server, and then online consultation type of service is also available. So this is the life, how it should be. Another thing we've been doing is that we try to make NFC, near field communication, as continuous compliant communication protocol. Currently, NFC has been discussed as touch area network within Continuous Alliance. And we see that by year 2013, a new guideline, including NFC, will be released. Actually, Continua already decided to adopt NFC for the future compliant communication method. So if in year 2013, new guideline will be announced, more and more devices will be supporting NFC, which is great for the market to grow. We are working hard together with the NFC Forum to push this approach. But meanwhile, we can use this type of the solution. We have developed this. The device data will be transferred through the NFC reader in a communication supported device communication protocol. So finally, I can show you the example of the company who is leveraging NFC dynamic tag in school environment. IHD is the US-based, Texas-based company who is providing the web-based technology solutions together with the heart rate monitor and NFC reader. Certain number of states in the US mandate schools to have aerobic exercise during PE class. However, the issue is most of schools don't have the way to measure the progress. That's the issue. So the idea behind that is to provide easy way to track the record and accountability to schools. Students will use heart rate monitor during exercise, and after the exercise, just tap that device on the reader, and data will be transferred up to the cloud server, then analyzed, and a report will be generated based on analysis and shared with teachers and parents. So as I mentioned, this type of the report will be automatically generated once data will be transferred up to the cloud server. So it's easy to share with the teachers and parents. Again, at Top Wellness, NFC Dynamic Tongue brings easy way to know your body. Thank you very much.
Setting wrap up, sorry. So this is the end of our day, end of our 2 days. I really want to thank all of you for attending. It has been an unbelievable, unbelievable 2 days. And I hope you had a chance to meet a lot of people and make a lot of connections. And I hope that we get to see you all in San Diego in June. Just visit our website. Please go on. You can also get videos of our sessions. Every single one of them was taped, and they'll be posted. We're hoping maybe in the next 3 weeks, 4 weeks, something like that. But if you're signed up for our little, I think it says it's called a newsletter. If you're signed up for that, we'll let you know. And we really appreciate you attending this year. It means a lot to the future of health and technology. Thank you.